Hello everybody, my name's Diane Porterfield-Bourne. I'm a nurse practitioner and I live in Worcestershire in the UK. I just wanted to put a quick post up on Facebook Live and I will share it to some other groups. But there's something that people keep asking me all the time. When I listen to ladies talking and they're saying that they're experiencing menopause symptoms, and they're saying, you know, why do you keep saying about HRT? I don't want to take HRT. Hi, Cheryl. Why should I take HRT? What's the big deal with this? I've heard it gives me cancer. It killed somebody that I know. I don't want to take it. None of my friends take it. Or I am taking it, but it's not helped me. Or my GP won't prescribe it to me even though I want to take it. So there are many issues surrounding hormone replacement therapy. But the majority of women that I speak to, they're very much against having hormone replacement therapy. So I just think I wanted to just put a little note out there today, just to explain a little bit about what it is and what it does. But first of all, and I think this is very important, is that any prescribed medication has to be a discussion that you have yourself, between you and your health provider, so the person that's prescribing medication to you. It's a personal choice, and hormone replacement therapy isn't what everybody wants to take. However, I do think it's important that people understand the reasons that health professionals like myself and other people do advocate HRT as a way of treating menopause. So therefore, once you're actually armed with all the right information, you can actually make really good educated decisions yourself whether you think it's going to be right for you or not. And so really the most important thing that I like to explain about it is that we produce lots and lots of estrogen, obviously, in our early years, in our 20s. When we're pregnant, we have huge amounts of estrogen whizzing around our body, and when we get into our 40s, our estrogen levels start to dwindle down. Hence we start to develop the symptoms of the menopause. But many people think, oh, you know, why would I want to take hormone replacement therapy? It's all man-made, it's all going to be bad for us, it all gives us cancer. Well, hormone replacement therapy is made from our own hormones. So the hormones that we become deficient in during the menopause, we have lots of types of estrogen, but the one predominant one that we become deficient in during the menopause is what we give you in HRT. Now, when I'm talking about HRT, the HRT I'm referring to is the things that's actually prescribed by a qualified health professional such as myself or your GP or other private menopause clinics. This is body identical hormone replacement therapy. Gets a bit confusing. But if you think that this is laboratory tested, the pharmaceutical grade medication that you get from your GP, that's in the drug formula, is that any health practitioner uses to write medications down. This is a completely different thing to the unregulated HRT that lots of these so-called clinics prescribe. They'll do a mouth swab, salivary mouth swab, and then they will look at prescribing you and making some very original HRT just for you. I don't advocate these types of hormone replacement therapy. The only HRT I do advocate, which are deemed to be safe and effective, are the types of HRT that I would prescribe and your GP would prescribe. So that's what I'm referring to with HRT. So people think that it causes lots of different health problems, but all we're doing is replacing like for like. So if we've had lots and lots of estrogen in our bodies when we've been younger, we become deficient in estrogen, and the deficiency in the estrogen has a huge impact on our physical but also our psychological health as well. Anxiety, lack of confidence, they're huge, and they have a really significant impact on the way that you function each day, whether you'll remember to get something out the freezer the night before, to lock the house. Do you actually know how to drive your car? And I'm not joking when I say I do know of lots of women that find it very difficult to function, actually to drive their car, because their brain just isn't working properly. So again, the lack of estrogen can have a massive impact on every aspect of your life. So it's not so much that you have to be fearful about the estrogen, because we've produced loads of estrogen in our youth. So all we'll be doing is replacing it with a manufactured, safe replica of what we've been using in the past. So this is why hormone replacement therapy is so important, because we're replacing like for like. There is a small risk of developing cancer when taking HRT, but this actually is incredibly small, and there are very few side effects and reasons why you can't take HRT. I often hear people say that they've got all these different health problems and therefore they cannot take it. All I can say to you is that please contact me and I will be able to discuss this further with you, allay your fears, and actually to tell you whether you can or you can't have HRT according to the national guidelines and the different societies that I've done qualifications in, and that actually lead the way in the research and menopause health within the United Kingdom. So many people say I can't have HRT and it gives me cancer and I don't want it, or my family member developed cancer from taking HRT. Women will all get breast cancer at some point. It is there within society. HRT does not cause breast cancer, but if there's a tendency there, then it can accelerate the growth of some abnormal cells there. But drinking alcohol excessively, being overweight in particular, is the most major contributing factor to women developing breast cancer, far more than HRT ever will. So those are sort of like some of the things that most people are very concerned about. What I look at really are so much the benefits of taking HRT, and the benefits of estrogen are humongous. The most predominant one really is heart disease. Women don't talk about heart disease, but heart disease kills more women within the Western world than breast cancer ever will. The differences are absolutely poles apart, and yet people are so fearful of the breast cancer element of breast cancer with HRT, which are actually incredibly small risk factors. But developing heart disease with not taking HRT are really, really, really significant. And a lot of the leaders in menopause education around the world have done an awful lot of research into the way that HRT protects your heart and thins the blood. It's vast, such a vast subject that we're literally just touching the tip of the iceberg here. But protecting ourselves now, treating symptoms, but also into old age, is a really important thing. It's heart disease, and obviously the bones is another huge element to it as well. So the most important thing is to think, would HRT benefit me? And for the majority of women, it certainly would. And that's improving your physical symptoms and your psychological symptoms as well. When women often say to me, I'm just going to see this through to the bitter end, I'm going to grit my teeth, and I don't care if I'm waking up 6 times a night with no bed sweating, I'm sweating, the bed is drenched. I have a very poor relationship with my partner. My brain's not working, I feel old, I look old, I don't feel myself, I feel very low in mood. I turn to people and say, why would you want to feel like that when there is some prescribed medication out there that can actually improve your quality of life? Hi Lorraine. So like I said, it's all about looking at the pros and the cons of it all. And I've done an awful lot of research, an awful lot of reading around the subject, and I prescribe HRT. I take HRT myself. I know how it's transformed my life as well. So it's thinking about this in a better way, and thinking, instead of thinking I'm going to listen to what everybody else is telling me about HRT, actually speak to experts, actually speak to people, hello there, speak to people that actually understand about hormone replacement therapy. Sorry, I've just got a message here from Claire. Why does it take so long to work? Everybody is different. Majority of women see a difference within a few weeks. Sometimes it can take up to 3 months. If it's taken longer than 3 months for it to become effective, then it needs to be reviewed again. Because most people that I know of see a significant difference in their health within the matter of a couple of weeks. Sometimes it can take sort of like a month or 2, even 3 months to actually work. But I do think that if it's not working, certainly by 3 months, then you need to be speaking to your health provider and finding out what's going on about it. Maybe the route needs changing, maybe you need some more investigations. And again, you know, menopause affects every single woman, and that's over 50% of the population. We're all going to experience menopause. Nobody's going to get away with this. The lack of estrogen can have significant effects on your physical symptoms and your long-term health. So it's thinking, do I need HRT? It's more the fact that really, should I be taking it? It's a question that you need to have a really good think about yourself and read up on it. You can speak to me. My name's Diane Porterfield-Bourne. Look me up on borntocare.co.uk. I give quite a few of these live Facebook talks about menopause and HRT. Sorry, I've got a message here. Can it cause aching? Yes, absolutely. Lack of estrogen has a massive impact on our muscles. We have estrogen receptor cells all over the body, so the lack of estrogen can really impact on our muscles and our joints. If you feel that you're 90 and there's no other physical reason why you've got that, because people were saying to me, oh, I've got arthritis. I said, well, who's diagnosed you with arthritis? Oh, well, I ache all over. Like I said, menopause affects every woman. Every woman will have an impact of lack of estrogen. And the lack of estrogen, you can replace that lack of estrogen by taking hormone replacement therapy. I do prescribe HRT. I have a private clinic in Worcestershire, which at the moment is closed, which I'll be opening again very shortly. But I'm doing online consultations, video consultations, which is a little bit very much like that we're in the same room together. I'm on HRT. Right, you need to I'm on HRT and still feel achy, sometimes terribly. You need to get that reviewed. You probably either haven't got enough of it. You might need some blood tests, but you might need a different route of HRT. So I'm doing online consultations. If anybody would like to book a consultation with me, I can discuss everything about their women's health, menopause related, and if necessary, then we can prescribe hormone replacement therapy. I make sure that I listen to what your main needs are, your main health concerns are, because we're all different. Thank you. We're all different, and some things work for one person and other things for another. And it's like, it's like if you have migraines, for example, I'm just not going to prescribe you one thing and go, off you go. That's going to be it. That's you sorted the rest of your life. Things need to be monitored, tweaked, adjusted, reviewed, and that's what I do. And it's a case of listening to people and seeing how I can help you. So today, I hope I've managed to sort of address some of the things related to menopause, particularly the views of HRT. I just find it quite despondent. I get quite despondent when I hear people saying all the time, oh, take these herbs, do this, do that, but don't take HRT. And it's a fact that you need to speak to medically qualified people that understand menopause and get their advice before you make any assumptions and buy over-the-counter preparations that may not work. I'm not saying that they won't, but let's see the evidence. As a health professional, I base all my experience on evidence-based medicine, evidence-based practice. Well, research says that certain things work and certain things don't. And HRT works and helps the majority of women. So it's a case sometimes of getting it adjusted, reviewed, looking at the route and looking at the dose of it. And sometimes it's just talking to a health professional with menopause experience that can give you that reassurance or that advice, or somebody just to listen to that truly understands what you're going through. So if you'd like to speak to me, you'd like to book an appointment to discuss menopause and HRT, please get in touch with me at www.born2care.co.uk, inquiries at borntocare.co.uk, and you can find me on Facebook as well. So that's me, Diane Porterfield-Bourne, at borntocare.co.uk, giving you a little bit of advice about menopause, but really a little bit about estrogen replacement in hormone replacement therapy. I hope I've helped you today, and please get in touch with me if you'd like to know any more. Thank you very much. See you. Bye. Bye-bye.